Welcome, everybody, to Concussion 101, Causes, Symptoms, and Recovery. We're so happy to be here with you tonight. Happy to share across the country. We know those of you closer to the East Coast, it's getting late. Those of you who are coming from the West Coast are probably right in the middle of your supper. So thank you for coming in and wanting to learn about concussions. My name is Andrea Kay, and I'm going to be the facilitator for tonight's webinar. We're going to start with our land acknowledgement. Lifemark Health Group acknowledges that our work spans many territories and treaty areas, and we are grateful for the traditional knowledge keepers and elders who are with us today, and those who have gone before us, and the youth that inspire us. We recognize the land and the benefit it provides us, and we invite everyone to reflect on the past and present history in their particular geographic area. And particularly today on National Day for Truth and Reconciliation, for each of us to think about what we can do towards reconciliation. Now, we're able to provide this information to you today free, thanks to the support from Lifemark Health and in partnership with the PC Health app. I'm going to share a little bit more about the PC Health app after we have our discussion, so you can find out all the benefits that you can receive when using the health app. I just want to talk a little bit about Lifemark. If you're not familiar with Lifemark, it is Canada's largest physiotherapy company. But we're not just providing national coverage on physiotherapy. It's a full spectrum of rehab services in over 330 clinics with over 3,000 clinicians. Depending on where you're located, you can see Lifemark with a bunch of different brands. Sometimes it's not a Lifemark name, but there's many companies that fall under that umbrella. But regardless of what the name is on the clinic, we are all passionate about enriching the health of Canadians. So tonight, we're using Zoom webinars. And if you're used to using Zoom for meetings, you're going to notice that a few things look different. You're not able to turn on your camera or unmute. And we want you to ask questions. We welcome questions, but it's not going to be in the chat. You need to open up the Q&A. So you're going to find that icon typically at the bottom of your screen, and just open up the Q&A, and you can type information in there, questions that you might have. The information that we're presenting tonight is for educational purposes only. It's not medical advice, and we're not able to give any person-specific advice or recommendations. Make sure you keep your questions to general, non-specific scenarios, and don't share any personal health information. After this session, if you'd like an individual consultation, we're going to share at the end how you can get in touch with Lifemark and find a knowledgeable clinician near you. As a starting point, certainly going to lifemark.ca is the best place to go. If you want to see the words as well as reading them, you should also have a closed caption option on the bottom of your toolbar. But you don't have to worry about taking notes. This session is being recorded, and we're going to share it with you. So all of the registrants will get a link directly into their inbox in probably about a week or so. We're also going to ask for your feedback, because we want to make sure that we continue to get better and better, and that the time that you spend with us is good value for you. So keep an eye out for the survey, and please make sure you fill it out and do give us feedback on what's happening. If you want to make sure you see both the slides and the speakers, you can play with the view in your Zoom webinar to change that and see what it looks like. Our panelists are physiotherapists and are bound by their professional scope of practice. And as such, we're not going to be providing any advice as it relates to medical management, including medical assistance, medical reconciliation, or medical advice. So without further ado, let's jump in here. We have gone to great lengths to bring you some very qualified folks tonight. So we're going to meet our two key speakers here. First, we're going to start with Jessica. Jessica's got 18 years of hands-on experience. How can you tell? She looks like a baby, really. But she's dedicated her career to helping patients recover, rebuild, and return to activities that they love. She currently focuses on orthopedic care, supporting individuals recovering from motor vehicle accidents, workplace and sports injuries, and post-surgical rehab. As a former NCAA softball player and Team Ontario softball coach and trainer, Jessica draws on her athletic background to address the unique needs and health goals of the patients she treats. When she is not in the clinic, you can find her coaching softball or enjoying a round of golf. Now, Tyler, we want to say a special thank you because he accepted to join us last minute because Laura Dickey is really not feeling well. She was going to come to us, but don't fear. Tyler has a tremendous wealth of background, and thanks for jumping in. With a Master of Science in Physiotherapy and Honors Bachelor of Science in Medical Sciences, he specializes in orthopedics, manual therapy, and has advanced training in concussion management, vestibular rehab, acupuncture, cupping, and soft tissue techniques. Tyler is a winner of the Welland Tribune Reader's Choice Award for Best Physiotherapy in 2021. So we brought you the best, folks. He emphasizes patient education, so important, and active rehab using evidence-based exercise, manual therapy, and modalities to support recovery. Outside of work, Tyler enjoys staying active through CrossFit, sports, yoga, and running. So some great folks we have to share information with you. We also want to acknowledge if you're asking questions, Evan Roberts, another amazing therapist, is in the chat. Q&A with fast fingers, busy answering your questions. We will have hopefully some time at the end for some live Q&A, so we'll be keeping our eye on that and making sure that we can answer some of those recurring questions. So as we move into fall, hockey and other contact sports are really starting to ramp up. And although concussions don't only happen in sports, with many people starting them, it's timely that we have this information now. So Tyler, we're just going to start out with that basic question. What is a concussion?
All right, well, great place to start. So, what is a concussion? So, a concussion is an injury to the brain that may happen after a bump or hit or jolt to the head, face, neck, or body. This sudden jolt can create short-term changes in the behavior of chemical messengers within our brain, as well as a change in the blood flow within the brain. It is this change of the brain messengers that and the blood flow, sorry, that is responsible for the symptoms that typically we feel within the first 24 to 48 hours after these types of injuries. A concussion essentially is like a bruise to your brain. So we know that a bruise and any other mild injury to other parts of our body tend to heal naturally. And it is the same with our brains. So, as previously mentioned, the impact of the concussion is noted because of the change in the blood flow, the change in the chemical messengers, and the swelling that's present. Because the skull is a hard bone, swelling cannot expand outwards, and therefore it's going to put pressure inwards on the actual brain tissue. And this is what we see in the initial post-injury phase. As time passes, the swelling will reduce, blood flow will return back to normal, chemical messengers will do the same, and this is why most concussions typically are transient in nature and resolve within the first 72 hours.
Cool. Okay. Well, it sounds like, that's a complicated process. And I think like anything with the brain, maybe it is. It certainly helps us understand kind of that basics of what happens. Jessica, can you talk a little bit more about what are some of the causes and the common causes that might lead to a concussion?
Yeah, so obviously people are very familiar with sports related injuries. Someone takes a big blow to the head or they have a big fall. But obviously there are other causes that that more adult population kind of deals with. So things like motor vehicle accidents, falls, especially in the very young and the very old, physical assaults, workplace injuries, sudden impacts or whiplash type injuries. The mechanism itself of a concussion, an analogy I like to give to my patients is your brain is like a pickle in a jar, for lack of a better term. So that pickle kind of floats in that fluid in the jar. But if I shake the jar, the pickle's going to kind of bounce off of that jar and hit. And a lot of people think our brains are sort of fixated in our skulls and that they are sort of stuck in that one place. But in actuality, our brains kind of do free float through that through our skull. And so when we get hit or when we either get hit in the head or we get hit in the body and our head kind of spins or reacts, that brain sloshes around in that skull a little bit. And it actually does kind of bounce off of that skull or kind of rotate. And it's that shearing force or that shearing that's occurring inside that skull that actually does produce that reaction or that response that Tyler was talking about, that energy crisis that our brain goes into and triggers all those concussion type symptoms.
Cool. I love that pickle analogy. Like I can totally visualize that floating around. We now understand that it isn't only athletes that are affected by the by concussions. And so the information that we're going to cover will be applying to everyone who gets a concussion. But let's talk a little bit specific about sports. What types of athletes are more likely to be impacted by concussions?
Yeah, so they talk a little bit. The literature right now shows that about 25% of concussions that occur are going to be related to sports. Females do typically tend to suffer concussions more frequently than males do in sports. And there's some thought to that is because men tend to be stronger up through, or their center of gravity is stronger up through their chest and their shoulders, whereas females are a little bit lower. And because of that, men tend to be a little stronger through their neck and shoulders than females do. So, it stands to reason that if our head's whipping around a little bit more, we're going to be more susceptible to things. Typically with male concussions, they're going to be a little bit more occurring as far as body to body contact, mostly because they tend to play more contact sports, whereas females will tend to sustain a concussion as a result of a blow or contact with like some equipment or the playing surface. Right now, when we look, about 85 to 90% of people will get better from a concussion within 2 or 3 weeks, which is great news because it does mean that this condition can get better. When we look at children, 70 to 80% of kids will get better in 1 to 3 months. So we know that they're going to recover a lot of times in a timely fashion, which means that there's a lot of good outcomes to this injury.
Cool. Okay, well, that really helps understand, I think, who's a little bit more at risk and, the people that we want to be a little bit more careful with and why. What about outside of sports, those concussions that aren't sport related?
Yeah, so there's still some limited research there. There's a lot that needs to be sort of looked at. In estimate, they're going to look at about 400 to 450,000 Canadians between the ages of 12 and up will sustain a concussion in a year or in the year. And this is probably underreported because there's a lot of people who aren't going to seek any sort of healthcare for their concussion because, as we said, it can get better on its own. But obviously, of those people, when we're looking at the breakdown, when we talk about people 20 to 64 years old, falls are still going to account for the biggest amount, usually at about 35 to 37%. And then motor vehicle accidents, transportation accidents will account for sort of another 24%. After that, kind of a mishmash of different things like workplace injuries, assaults, and other things. And then when we look at older adults, and this is a population that sort of gets a bit under noted for concussions, but the elderly, 65 and plus, will falls 86% are going to account for a lot of their concussions.
Yeah. No, that makes sense. And I see a question in the Q&A just asking about, are there clinical trials? So there's a lot of research that needs to be done, and certainly I think we will continue to look into it as we learn. I mean, you think about how concussions were treated 10, 20 years ago to now, we are learning all the time. So we're going to talk about the systems, different systems that are affected when we sustain a concussion. But, we're going to ask, can you talk a little bit more about what people tell you in the clinic, Jessica? What do you hear from folks when they've sustained a concussion?
Yeah, so there's the challenging part about concussion is that no two concussions are going to be the same. There's a number of different systems that get impacted. And while one person may experience headaches and dizziness, the next person might be experiencing neck pain and sleep dysfunction. So it makes it challenging as a clinician to be able to kind of pinpoint everything. But what we do is we typically do a deep dive into the different systems that are impacted. So really common things that I'll hear from patients are things obviously like headache, dizziness, difficulty reading, hard time focusing or concentrating on things. And each of these different systems will impact things in a different way. So for example, your vestibular system is responsible for balance and coordination. So someone who's having some challenges with that might experience, dizziness or feeling a little bit off throughout the day. We know mental health is a very strong piece when it comes to concussion. And we know that a lot of people who already have mental health concerns coming in can oftentimes see those mental health symptoms exacerbated by a concussion. We'll see a lot of people with sleep dysfunction. So people who either be sleeping way too much, meaning they just can't see themselves getting awake, or not able to fall asleep or not able to stay asleep. And so we understand that sleep is such a huge component of recovery that, if this is a persistent system, how it can be challenging to sort of resolve. The autonomic nervous system is our center for regulating our heart rate, our blood pressure, and lots of other aspects of day-to-day life and our responses to them. So people who experience autonomic dysfunction might notice elevated heart rates, sweating, just feeling more stressed and a bit more anxious than normal. I'll have people with blurred vision, people who will have really difficult time sort of visually focusing on things, motion sensitivity. These are all really common things that I hear from my patients, and we can typically attribute them to any one of these systems that are impacted. And as I said, a lot of people, will get better in a short period of time, but we have to kind of pinpoint where these symptoms are coming from.
Wow, that's a big list, and lots of different things. So it stands to make sense that people will say different things and have different areas affected. So super helpful to try to understand that. And it's great for us when they come in to see a physiotherapist about this, but we don't always get to talk to people first, right? Like we might see them on the sidelines. Is there any way that we can tell visually if somebody has had a concussion, or like what are the things that we might need to look for? Tyler, can you talk to us a little bit about kind of the signs or the things that we might see?
Mhm. Yeah, so one of the newest pieces of evaluation that we can kind of use to pick up on concussions from a sideline perspective or an acute perspective is the CRT6, so the Concussion Recognition Tool 6. So this is a screening tool to kind of determine whether somebody has experienced a concussion, but it also helps to provide direction on what actions should kind of be taken following the screen. So initially, it kind of takes you through some red flags, so bigger things we got to keep an eye out on, and then followed by three separate screening sections. So ideally, we try to do this as quickly as possible after the injury, preferably within the first like 1 to 3 hours. And then we try to repeat that at regular intervals, the following to determine whether any sort of change in status has happened, and then to see whether further medical evaluation is warranted. So if we go to or if we look at the slide here, this is kind of the first section of it. So this describes what we're looking for in kind of those visible signs of concussion. So the big ones, loss of consciousness, lying motionless on the field, falling unprotected. Those are kind of the easy ones to look at. And then you have things like disorientation, they're slow to get up, if they are unsteady on their feet, or kind of those balance problems. So for anybody that's kind of following sports and concussion in sports, that's where you see a lot of the spotters. So people up above the game are being able to pick up on these kind of signs very quickly, and that's when they'll go to kind of the medical tent to administer this and evaluation there. There are two other sections that aren't on this slide, and so those are more the suspected symptoms of the concussion. So they kind of separate them into three groups. So physical, changes in emotion, and changes in thinking. So physical would be your items such as like your headaches, your head pressure, balance difficulties, those kinds of things. Changes in emotion would be if they have increased irritability or increased emotional responses or heightened responses afterwards. And changes in thinking would be like difficulty concentrating, remembering, dual tasking, those kinds of things. The last section is kind of awareness and alertness. So basically, these are your standard questions of where are we today, what event are we doing, and seeing how oriented they are to the time and the place. So all of these combined will help us to determine kind of the extent of the injury. And also if they do not pass these tests, then that kind of tells us that we should probably evaluate them from more of a medical perspective. So speaking of kind of those situations in which further medical might be warranted, it's important to note that although the severe cases are not as common as more as your mild concussion, when they do occur, we do need to know when to pick up on these kind of major signs and symptoms or red flags. So the CRT6 is actually really helpful in picking up on that as well. So you can see here a kind of comprehensive list. So neck pain, seizures, double vision, loss of consciousness. Again, a lot of the stuff that we talked about before, restlessness, agitation, severe headache. So really, the one thing I want to point out with all these is that if they have one of these symptoms, it might not be an immediate cause for concern, because it is quite common to have at least one of these. So typically, we would see kind of like a combination of a couple of these symptoms. I'd say in clinic, more often we see like neck pain, double vision, vomiting, headaches are more the common ones. Um, so it is important to remember that although a majority of people do not experience all of the above noted symptoms, again, they can get, or they often will get better within the first few weeks without any intervention at all for a standard concussion. However, we do know that people can experience more significant and lingering symptoms, especially with all the systems that Jess kind of talked about that can be affected. So it really is important to kind of make sure that we're trying to get individuals back to activity as safely as we can, because we know the quicker we can get people back in a safe perspective, the overall results kind of improve, and typically getting back to life will happen in those transitional phases.
Yeah, a few things that stick out to me when you talk about that. You think about asking these questions like where you are, what time it is, who's winning the game, what have you. And it seems like nobody's going to get those wrong. And it's very interesting when you do sunlight coverage, the answers that people come up with. Like they seem normal, they might look a little bit dazed, and then you ask them a question and they're like out in the left field. They're not in the right year. They might not be in the right city. So these simple questions really are key to helping people understand whether you have sustained a concussion or you need to kind of look deeper. So um, the the test that we're talking about is easily available. It's certainly something that should be handy if you're providing coverage, or certainly is something that you can print off and become more familiar if you are attending a lot of games, if you have family members that are involved in these sports or happen to be particularly those higher risk people, or even family members. Just talked about older adults who fall a lot, and to ask them those questions, and be familiar with the tool because it's developed for anybody to use. It's really I think very very handy. So, we're hearing, and certainly when we look at the number of systems that can be affected, that everyone's going to experience this in a different and individualized way. We understand that, but just can you talk a little bit more? Is there consistency in how long these symptoms usually last, and maybe how can we return back to life or sport or activities after a concussion has been sustained?
Yeah, it's a great question. So the challenging part of this is, and the biggest question I get is, when am I going to feel better? What the literature tells us and has looked at is that there's a lot of people that are going to get better, or at least see a significant improvement in their symptoms in just as short as 72 hours. So that initial 24 to 48 hours is sort of that worst period where those symptoms really do pile on. Typically, people will feel sort of the worst that they're going to feel, and then we start to see some, in a lot of people, resolution happen. As I sort of alluded to before, some of the literature has talked about, in adults, 80 to 90% of people will get better within a few weeks. Some other studies looking at similar populations say within 1 to 3 months, most people should fully recover. In children, that number is, a little lower, and 70 to 80% sort of improve within 1 to 3 months. A lot of times that's because there's still ongoing brain development. And so, it may be a little more challenging for them to recover in such a timely fashion. But again, the good news or the positives about this type of injury is that there's a lot of things that can be done to kind of speed up that recovery process. What we struggle to know right now is some of the factors or the prognosticators that make it challenging for people to recover. So there are a few things that some of the studies and information are starting to come out and say, if this is happening early on, you may be someone who's at risk for your concussion taking a little longer to heal. So that's things like immediate onset of headache, immediate onset of dizziness, fatigue, fogginess, or really difficult time with neurocognitive processing or disorientation in the initial stages of that concussion. So in that first 24 to 48 hours. really persistent neurocognitive impairment. So people who are struggling to process or to remember or to think the way they did prior to their injury, typically have a little longer outcome or a little more challenging time sort of recovering. We know that a history of prior concussion is a major factor in recovery. So, the more of these that you pile on, the harder and harder it is to recover. I always use a specific analogy with some of my patients about you throw a pebble into the water and the ripples kind of last. You have that concussion, but that it may recover and settle back to normal, but that pebble's there. So it's always changed that water so that when another one comes on, we kind of constantly keep changing and can have different effect there. So, we can see the cumulative effect of concussion, and we know from the literature that the more of those that we have, the harder it is to recover. And then prior history of things like migraine and mental health also have, some outcomes that can make it a little more challenging for a person to recover because, I once heard someone say concussions fight dirty. So when they hit you, they go after some systems that you may have already had some impairment with. And so it can be challenging to recover and, sort of move past those. There are a couple of things that we can do, as I said, to sort of influence a good or a better recovery. So we know that the earlier the intervention or that we start the recovery process, the better, which means early identification of the issue. So seeking a consultation early on in the process and having a proper diagnosis of concussion certainly assists with that process and leading us towards that better outcome. And what we also know is that, if we start early intervention and get ourselves moving and going within, a reasonable time frame following that concussion, that it leads to a better or much more positive outcome. So what we know is that, most people who have a concussion can potentially return back to activity within 72 hours following that concussion. We're not talking about them returning back to full everything. What we are talking about is returning to what I like to call active rest. So this idea of engaging in light sub-symptomatic activity. So we're not looking to reproduce our symptoms or drive them way up, but what we are looking to do is get out of that dark room. Right? We want to get out of that dark room. We want to get out of bed. We want to start doing some light housework, some light activity, go for a walk. We always tell kids tell parents take their kids' phone away. Don't let them see a screen. But we do those things on a day-to-day basis. So we do want to start engaging in some of that within a reasonable time frame. I don't want anyone to be doing anything for hours and hours on end, but what I want them to do is I want them to slowly start building into some of their symptoms. A lot of times I'll use a scale, so 0 to 10 on their symptom scale, and I'll have them do some activity. And if their symptoms creep up, maybe 2 or 3 out of 10, that's pretty normal, a pretty normal response to increasing or doing some activity. And, we want to creep up a little bit and then rest. And then we want to creep up a little bit and rest. And it's the only way that we can kind of build on that recovery and start to see things move in the right direction. So anytime we're talking about a return to exercise, a return to activity, a return to school, a return to work, we want it to be graduated. We want it to be graded. We want it to be well controlled, and we want it to stay within tolerable limits of our symptoms. And we wanted to include early on, especially things like some modifications to make it much more successful. So for example, if you have a young child returning back to school for the first time, maybe we're going to not have them go during the busiest, like in the morning, first thing when the hallways are packed, and we're going to have them walk through all that chaos. Maybe they're going to show up to school a little bit late. And they're going to sit in the back of the classroom where they're not having, all these distractions around them. And maybe they're going to spend some time in the library so that they're not, constantly in that classroom. Maybe their teacher is just going to speak with them, and they're going to, someone's going to take notes so that they have it later. If we're talking about return to work, maybe we're looking at not starting our hours during rush hour trying to drive to Oakville or Toronto from, Hamilton or Niagara Falls, so that we're not having to deal with that stop and go, so that by the time we get into work, we're so exhausted we can't even do the work. We're going to increase things like font size on our screens. We're going to play around with the brightness. We want to set ourselves up for success, because one of the things that we do know about, return to activity and return to any type of normal activity that we do is that if we constantly push ourselves to a point where we can no longer achieve it or no longer do it, the more times that we do that, the harder and harder it is to get going and harder it is to recover. So we want it to be sustainable and we want it to be successful. So, the modifications early on, the graduated, the pacing and the timing of it certainly helps to, keep the symptoms under control and to see some positive steps and gains made through each things. So we're trying to return back to as much normalcy as we can over the days and weeks, in an effort to, restore ourselves to kind of where we once were, making sure that our symptoms are well managed. And we certainly, as we progress through those phases, before we jump to the next phase, we want to make sure that we have a good handle of our symptoms in the present phase that they're in. Unfortunately, there are some people whose symptoms do linger past that sort of, few weeks or a few months that I talked about. And in those cases, sometimes we do need to get help from a rehab professional. And obviously there are ways that, physio and other rehab professionals can help, get this condition fixed faster.
That's a lot. And again, I'm hearing that we're going back to this very individualized treatment, right? It's how you're feeling. You can't wait to be feeling 100%. We're always going to be pushing a little bit, but not too much. So it is definitely this balance of going forward, coming back, going forward, coming back, but maintaining that control. So that was a really great explanation. And again, I see some of the questions in the chat kind of asking for, that a phase 5 or, phase 4, phase 3, 4 can take a long time or a short time, depending on where you're at and how you're feeling. So there is absolutely no cookie cutter approach here. So, really appreciating what that looks like. If you do need treatment, if looking at predictive factors, et cetera, can you walk us through that, Tyler? What does that look like? What can people be expecting if they do want to actually have treatment versus just a little bit of rest?
Yeah, so when it comes to like a concussion assessment, I often will kind of preface it with clients that it is a little bit different than your typical musculoskeletal assessment. There are a lot of other components, like Jess had mentioned, that we kind of have to look at when it comes to managing concussion. So we try to drop a little bit in like a lot of the history, but also a little bit of objective data in all the different sections. So initially, an assessment will start with a subjective history. So that's just getting an understanding of how the injury happened, what the symptoms were like immediately afterwards, how the symptoms have progressed, the intensity of the symptoms, and then starting to look at what factors are aggravating for those, what factors are relieving for those. And subjective history is really crucial for concussion because they talk about concussion being the invisible condition where we can't pick up and see what's going on the inside. We need patients to be able to tell us and report some of that information as well, as compared to like if somebody breaks their arm, I can see their lack of range of motion, but to pick up on headaches or dizziness or light sensitivity, that's all subjective report. So it's really important to get a good history of what's going on symptom-wise. They're also tying into that a little bit of that mental health screening as well. We'll ask about a little bit of any past medical or mental health conditions or concerns, and even some concerns that might have arisen as part of the concussion, because again, concussion can be a very isolating condition when not everybody can see how patients are feeling symptom-wise. So it can sometimes be a little bit difficult to explain that to people around them. So, like Jess had mentioned, mental health can also be something that can arise as part of a concussion as well. Then we go into a little bit more of the objective assessment, so looking at the cervical and the thoracic range of motion. So the big ones are the neck and the upper back. So looking at the range of motion, looking at the strength, the ligaments, and seeing how those joints are all moving. Again, they can be drivers of a lot of the symptoms. Usually then we'll get into some vestibular ocular motor, which is a big fancy word to explain a group of testing that talks a bit about how the eyes and the inner ear system and balance system are functioning. So again, we talked about how they have often double vision, blurry vision, and then when it comes to balance, it can be falls. It could be when people are talking about dizziness as well. That can be in relation to that vestibular system. So the vestibulo-ocular motor kind of encompasses all that. Is a very common tool when it comes to kind of looking at concussive symptoms. Additionally, as part of this kind of assessment, if some concussion clients can also experience vertigo as well. If you have a physiotherapist that is also trained in vestibular therapy, they can do some testing to rule out if vertigo is also a part of the concussive symptoms. The other part that sometimes I typically is tough to get to on day one because there is a lot, but as part of testing, usually we'll also look at autonomic dysfunction. So that's usually assessed by checking out blood pressure response during like positional changes or activities. Because sometimes, again, people can get changes in terms of their vital system that can cause some of those increases in energy expenditure with activities that normally shouldn't cause that same level of expenditure. Um, and then building off of that, that also ties into a bit of the exertional tolerance as well. So with that type of testing, we'll usually do a graded stationary bike test or the Buffalo Concussion treadmill test, which is also a graded walking test. I always tell people it's not running. We're not making you run. But again, this is a continual progression of exercise intensity, looking at finding where that threshold is where individuals start to have their symptoms go a little too high. And then that will allow us to give them a threshold or a heart rate that they can work at, like Jess was saying, where they can start to gradually increase their activity, but staying sub-threshold. So we're not provoking symptoms that way. And then really like the last thing we'll kind of look at as well too is a little bit of general motor function. So that's kind of looking at balance, coordination testing with some balance scans. So if we can get through it all on day one, that is very great. But generally speaking, as you can tell, there's a lot of testing that can be done. So I often explain to people too that we do not have to do all the testing on day one and just kind of base it more based off how their symptoms are progressing. Because eventually, if we do all this testing, everything feels very symptomatic. It actually doesn't give us any valuable information because everything then is symptomatic. So we want to be able to digest what's actually happening from that testing. But the big thing when it comes to it is kind of the three earlies, right? So early detection, early management, and early education are really critical in how we can manage the concussions and lead to a more positive outcome.
Wow. That's a lot of things that can happen. And, I guess it speaks to the number of systems that might be affected. We've got to do different tests throughout. Um, you know, you folks have shared really a ton of great information with us tonight. And, I can see in the chat, people are like just keen and eager to get personal information. What about this? What about this? And, as I said, we're not able to share that information, but I think it is important to know that, if you're feeling off, if you're feeling something different than you're used to feeling, you should get it checked out, particularly if it's lingering, right? Tyler just said early detection, early management, and early education are critical. And we see that we have folks on here that have had symptoms that have lasted a long time. So getting into seeing people who have specialized in advanced training in concussion, I think is really helpful. And, I think just getting a better understanding that basis of a concussion, how to recognize and what to do about it was really our goal of this session, knowing that we can't treat you individually on this session. So we're going to get to some of those questions that keep popping up in the Q&A, and I'm going to give Jess and Tyler the opportunity to look at the Q&A a little bit while I talk to you about the PC Health app. And again, because of the PC Health app, in partnership with Lifemark, we're able to provide this to you free tonight. And so I do want to give a shout out to them and share a little bit about what the PC Health app is. So if you don't know, or if you've never used the PC Health app, I know some folks actually joined the webinar from the PC Health app, so some of you are very familiar. But it is a digital tool that was developed really with a goal to help increase access to healthcare for Canadians. We know there's a big issue with access to healthcare, so we really are continuing to work towards finding ways to make it easier. It's available in an app or on a website at pchealth.ca, and it allows for that easy access of health information supporting you to be able to achieve your goals. And there is a bunch of information that is helpful and helps kind of guide you in different directions that you can go. On the app, you also have the ability to book appointments for Lifemark for physiotherapy and massage, as well as some mental health services. So you can book and manage pharmacy services as well, including minor appointments for prescriptions through the digital pharmacy feature. There's a significant amount of information available in the PC Health app, including different health journeys, depending on different issues that you're having. And it includes a lot of information about concussion, dizziness, and balance. So it's kind of a good level set to kind of get into. Check out the PC Health app. And so that's the end of my soapbox, but it really is, it's actually quite handy. Now we're going to get into some questions, and again, thank you, Evan, in the Q&A for helping answer these as we go along, and thank you for sharing your questions. As we get closer to the end of our time, let's look at some of those common questions. And Tyler, maybe we'll get you to start and just address a couple of things that you see. What's the question you're seeing, or you hear also in the clinic a lot, and the answer.
Yeah, I guess like one of the ones that I often will hear about is people who talk about, I get headaches every time I am kind of exposed to light. So what should I do? Should I stay at home and stay in the dark, or should I wear my sunglasses all the time because I feel better when I'm wearing my sunglasses? So when it comes to kind of light sensitivity, I think, one of the big things that's changed in concussion rehab, like you had said earlier, is that we used to say sit in a dark room and come out when you feel better. The problem is when you come out, there's lights, sound, noise, all this environmental stimulus that you're not prepared for. So it kind of goes along the lines of what Jess was saying when it comes to light sensitivity. We want to gradually expose ourselves to it. So often in the beginning, you may want to use your sunglasses a little bit more, wear some hats, maybe make sure you can get in the dark areas a little bit more, but then gradually build up that tolerance. So maybe you start with 10 minutes with no sunglasses at school, and then maybe it's one period with no sunglasses at school. Or maybe if you know you're going to be in a busy environment, I'll put those on, but otherwise I don't use them. So it's kind of a lot of people tend to like the boom or bust. It's either I do all of it or I don't do it at all. And meeting in the middle is kind of that tough part. And that kind of analogy ties out into a lot of symptoms, but I think the light sensitivity is a big one that we always we have. And same thing with clients in clinic. They'll come in with their sunglasses and they'll want to wear them all the time, dark rooms all the time. But eventually we got to start to say, let's pull that back and try a little bit of that.
Yeah, for sure. And I think it's like anything when we look at this graded exposure. If you are healthy and you want to start running, you don't just start running and feel great, right? You have to go, you have to be out of breath, you have to feel uncomfortable to a tolerable level, and then back off and continue to push. Jess, I'm going to throw you on the spot here because we have some people asking kind of more about these long-term concussions and, suggestions on what they can do, and just talk a little bit more about those lingering concussions and some of the symptoms that just really don't want to go away.
Yeah, the hardest population as far as concussions that we work with are the ones who linger kind of outside of what that normal timeline would be. The post-concussion syndrome is what it's called, because it's called a syndrome because they don't fully grasp or understand why some people do linger as long as they do. It's really similar to a chronic pain experience where it's outside of that normal realm of healing. So I'll use an ankle for an example. If I fracture my ankle, the bone heals, everything is on x-ray and surgically or whatever it is has gotten better, but I continue to have pain there. That is um, a bit of an abnormal response for what the body should be experiencing, because things have healed, but it's a very real pain that person is experiencing. So similar in concussion, the brain itself has healed after those initial few weeks. So all of the energy crisis that it was going through has healed, but the systems themselves are continuing to experience some sensitivities for whatever reason. It's at those times that there maybe needs to be more people piled onto that person's medical team. So, we maybe need to bring in someone like a neurologist or a neuropsychologist to assist with some of these things, along with the rehab professionals, such as, I think someone in the questions asked, who's a rehab professional? So things like physiotherapists, chiropractors, occupational therapists, naturopaths, osteopaths, all of those sort of people deal with concussion in different ways. But when we see people with lingering symptoms, they are really quite challenging, because it's hard to get a handle on exactly what it is that's leading to that sustained or prolonged response. And so then a more thorough evaluation from maybe more than just a family doctor, from a physio, from a chiro, we do need to probably look at, like I said, a neurologist or a neuropsychologist to see, is there something maybe a little bit more centrally that's causing these symptoms, not systems, symptoms to persist, or some of the sensitivities within those systems to persist. So, the challenging part, and I deal a lot with patients with chronic pain, and the biggest thing that we try and encourage and we try and teach is, obviously symptoms are coming on for people, whether they do nothing or whether they do everything. So we try this idea of continuing to engage in activity, continuing to try and build tolerances, and see whether or not we can, steadily progress the functional stuff that people do, in an effort to see, okay, well, I might still have a 10 out of 10 headache, but now I have a 10 out of 10 headache. Instead of just laying on my couch, I have that 10 out of 10 headache. Maybe I have a 10 out of 10 headache, but I also went for a walk. So just trying to increase and improve function and outcomes for people by encouraging them to become a little bit more active if they can. But certainly in situations where people's symptoms are really persisting, it might need more than just your standard rehab professionals might need to engage in some specialized care.
Well, thanks. Yeah, again, really back to that individual care for different people. Along that line, Tyler, people talk about tests and CTs and MRIs, and like, what's the best test to see if you've got a concussion?
Yeah, so I mean, at this time, we don't really have like a standardized imaging or anything that can pick up on concussions. I know there is some areas of research that are looking into like blood flow testing, but right now, concussion diagnosis is generally made based off of an examination from a medical doctor. So it would include some of the stuff that, we talked about, was testing out some of those symptoms. Um, with looking at the nerves, looking at kind of the neck, looking at the inner ear and the eye system. Um, and it's primarily taking that and along the lines of where the symptoms are at and putting those two together. They may send you for testing to kind of rule out some other major medical conditions, brain bleeds and stuff like that. But generally, those types of imaging will not give you a concussion diagnosis. It'll be after that. And I think one of the questions on there was asking about like if the doctor will send you to physio after the diagnosis. Generally, that's hope. The hope is that the doctor will get the diagnosis and send it to us. But I think Jess can probably say the same too, is that often we do get people that will also self-refer and kind of say, hey, I know something's kind of up. I can't get into my doctor. I'm gonna come see you guys first. What do you think? And then that's where, again, we could come in with some of those testings to kind of see what the red flags are. Do you need to go see the doctor? And kind
Yeah,
of
because
work from that.
the important part in that obviously is that only a doctor can diagnose a concussion in Canada. So physio, chiro, we don't have the ability to diagnose that. So only a doctor can. So yeah, you need the doctor to diagnose it. we sort of work on the treatment end.
Yes, have the skills to recognize what it looks like, right? One of the things that I think is good is we want to see clear CT scans. We want to see normal MRIs. That doesn't affect what you're feeling or what your concussion is. It's just a good sign, but it's not something that you should be seeking out. And certainly do not wait for treatment based on a test. We know how long these can be at some point, and the vast majority of those are going to be coming back normal, which is great, but don't wait for it. Who wants to talk a little bit about, there was a question about young children. Like, I mean, young children are falling, they're hitting their heads all the time. Does that need to be checked out? Is it normal, or what's the best course of action when you've got kiddos who are learning to walk and run and ride the bikes and all the things that that they'll do while they fall down?
Yeah, so I would say similar to what we were talking about, if you're seeing changes, if you're noticing flags of any sort, or if your child is reporting, something feeling off, something feeling wrong, especially if they're very little and they're having a hard time sort of telling you exactly what's going on, that might be worth a check at least. But yeah, it's on a case by case basis. There are some kids who are made of like little rubber balls and they bounce off the ground and they're fine, and then there's some kids who will fall and yeah, they'll start to feel really off, or they'll start to have a headache, or they'll, maybe they'll be sick or something like that, and in that instance it would be worth at least having a consultation with the doctor to ensure that nothing's going on.
Yeah,
Awesome.
I would say too, when it comes to kids, like obviously they can't provide as much of the reporting of the symptoms. So sometimes like picking up on things like if they were very much like a high energy kid, and then all of a sudden they start to be a little bit more like nappy often. They're not as, rambunctious. Sometimes stuff too, if you find them just like, doing stuff where they're holding their head or rubbing their head a lot. Some of those symptoms are stuff that you can kind of pick up on where like, or again, if they're very much like a well-mannered kid and then all of a sudden they're very like loud and not misbehaving, like stuff like that. If there's no head injury, then that might just be a kid being a kid, but if there is that history of the head and then you see a shift in their behavior, that would be something like Jess said, I'd probably say to at least get it looked at.
Yeah. Thanks, and I think that's valuable. Yeah, I love that rubber balls. It's true. They're just bouncing around, and I think that's really that's true. We see it happening all the time. So we're going to start wrapping up here. If there are other questions, certainly you can keep those coming in and into the chat. We did want to take you and show you the different ways that you can get a hold of us. There was a comment about some difficulty getting a hold of us, and so at Lifemark Health at Facebook, Twitter, Instagram, all the socials, a phone number, web referrals. There's lots of different ways. I did comment on the PC Health app to book an appointment. When you do that, that will link you into the Lifemark patient system, which is a secure place. It's not through the app that's collecting the information. It's actually going into the Lifemark patient system if you do choose to book online. But of course you don't have to, because there's lots of different ways that you can do that. We really do appreciate your time tonight, and we'll also appreciate your feedback. If you can wait for that feedback survey to share with us how this webinar was, but also other topics that you would like to learn about, because this is where we continue to grow and make different offerings based on the information that you share with us. And again, with over 330 clinic locations and thousands of dedicated providers, Lifemark is proud to be a trusted partner in your health journey for Canadians. We remain committed to expanding access. Access is a big deal. And, you just heard only a doctor in Canada under the regulations can actually diagnose a concussion. That's absolutely true. But there are very qualified professionals that can look at your symptoms and start treating you with that early education, early access, and early initiation of treatment. Certainly recommend you do what's most comfortable, but we have some great trusted providers that can walk you through that journey in a very safe and healthy way, and work with your medical doctor to make sure you're getting all the care that you need. If you need support, or you know someone who needs support with concussion or otherwise, we are here for you, and we want you to reach out whichever way works best for you. Thank you again, Jessica and Tyler and Evan. Also, thanks to all the background people who helped in bringing this together for you tonight. I hope it's been helpful. Again, we know it just skims the surface. There is so much that's individualized when we talk about concussions. If you're feeling off, get it checked out. I think that's probably the best piece of advice, knowing most of this stuff will settle on its own, but there are going to be some lingers for reasons that we don't know, but we certainly want to help walk you through that and walk with you on your journey to recovery and becoming the best of yourself. Again, reach out with questions. Thanks to our panelists, and we will let you go as it is getting quite late in the eastern part of the country. Thank you again for joining us. Thank you from the Lifemark team and the PC Health app. Good night, everybody.